Welcome to episode 1 of Walk in Our Shoes, a podcast about working at CHEO during the COVID-19 pandemic. CHEO is a global leader in pediatric healthcare and research. Based in Ottawa, CHEO includes a children's hospital, children's treatment centre, school and research institute, with satellite services located throughout eastern Ontario. What you are about to hear is a conversation between our president and CEO, Alex Munter, and Jackson Wu. Jackson joined CHEO Environmental Services 11 years ago. He works all over the hospital, cleaning and sanitizing in the emergency department and inpatient units, reconfiguring meeting rooms to accommodate the day-to-day needs of the organization. He runs the scrubber. It's like a floor cleaning Zamboni. He's part of the team that keeps CHEO clean and safe. And I should mention, this is also a love story. Jackson and Irene met at CHEO. She's also a member of the CHEO Environmental Services staff. Listen to Jackson sparkle when he talks about his enthusiasm for serving children, youth, and families at CHEO.
You'd be somebody who knows every little nook and cranny of the hospital, right?
Yes, I know everywhere.
Yeah.
I'm pretty familiar with the building.
Yeah, you know all the back stairways in and out.
I clean most of them when called upon. If they ask me, I'll just go do it.
And how has your job been different since March, since we went into the pandemic?
We've had to move a lot of furniture out of the hospital. As an example, the cafeteria. So we would have to remove extra chairs and tables and pretty much everywhere in the hospital just to meet that government's mandate. That's changed a lot. Also, we used to collect masks, N95s and all kinds of masks, just in the event that we were short.
What's the best part of working at CHEO?
Interacting with people, children, families, ensuring that they are well looked after while their child is in maybe in a stressful situation. When I see them, I'm just there to help. So
if you and Irene, the two ES staff, your house must be very clean.
As clean as can be, yes. Yes. The only thing that is difficult on us right now is I'm working days and she's working nights.
So she's working nights?
Yeah.
6 a.m. to 2 you're here, then you go pick her up, 3 to 11, then you go get her again. So that's your kind of round-the-clock working for CHEO's kids.
Yeah, pretty much, yeah. I'm committed to the hospital, so whatever it takes. Like, they were short-staffed for a while with the screening program, and then they approached us looking for support, so I said, I'll do it. Just made sure that, everybody was well looked after.
The other thing, too, that I think is really important for people to understand is that our environmental services staff are part of our quality and safety teams. Can you talk a little bit about that, about the fact that really you are part of what keeps CHEO safe?
They just implemented a new phone, so one of the cool things about it is that it identifies what rooms need to be discharged or cleaned, or if there's a spill, there's communication right in your hands. Having this device in your hands actually will improve the way that we clean in the hospital. With COVID-19, there's extra cleaning around the hospital, 24/7, extra precautions in place.
Yeah, and people who clean in hospitals, environmental service workers in this hospital and across, are really, in many ways, the unsung heroes of the pandemic in terms of making sure that safety precautions are protected and maintained, right?
Yes. We just want everybody to be safe. We just want to make sure that the place is healthy.
What's your favorite part of the hospital?
The cafeteria.
Why?
I like their food.
They got great food, that's for sure.
Yes.
That's for sure. You will have, 11 years, so you'll have seen thousands and thousands and thousands of kids and families. Is there any kind of that stick in your mind, kids that you've met?
One child, he was here for close to 1 or 2 years. So I'd get in and instantly, if he was awake, he'd come up to me and says, I'm going to help you clean. If I can distract his mind while he's in a hospital, especially for that length of time, it makes me happy. And it's worthwhile coming to work that you have this little family member that's not feeling well, and all he wants to do is help you clean and spend a little time with you. So that was really great that I got to meet him, and he still comes around, but he's not an inpatient anymore. He just comes in for appointments and checkups and stuff. Well, I often see people and they would, hey, I don't remember your name, but I remember who you were. You took care of my son when I was, I remember you. So I'm a little bit surprised that they would remember me, but I guess it's because they were stuck in a room for 24 hours a day, and some people, maybe I got this touch, I don't know. But
how does that make you feel when that
I feel fantastic. I feel wonderful, and it makes me want to come to work even more.
And do you think people, whether here or out there, understand just what an important role the environmental services staff play in a hospital? Do you think that's appreciated and understood?
Sometimes they don't understand it, but I believe the community is aware now. With COVID-19, now they're understanding that there's more work to housekeeping than just cleaning.
Well, thanks for being such a great ambassador for CHEO and for environmental services. And we really are one team here. So thanks, Jackson, for being such an important part of our CHEO One team.
Thank you for having me today.
This has been Walk in Our Shoes, a podcast about working at CHEO during the COVID-19 pandemic. If you think CHEO might be the place for you, see the careers page at cheo.on.ca.